Who is Rise Health?
Rise Health is an early stage company founded on the premise that we can help systems like BMC deliver on their mission of exceptional care without exception. We've helped and designed a system that looks at patient flow from end to end, from the first time they call in to make an appointment all the way through their coordination of the system. Our patient coordinators help patients understand what their needs are and how to best address those needs, whether it be a virtual visit, whether it be an emergency room visit if that's necessary, home health, or their physician visit. And once they get to the physician, to make sure that any follow-up care, lab work, specialist work is coordinated for them so the patients aren't off by themselves. Our patient coordinators have this special focus on helping patients navigate the system. Our goals in doing that are try to deliver on a promise of better access, a better patient experience, which includes higher clinical quality, and of course to lower costs all at the same time. And we think those three goals, as laid out by Don Berwick, the head of CMS, are mutually reinforcing with a well-designed system.
How are patient coordinators different from the people who work in the call center today?
Well, that's a great question. The first answer is really the broad set of skills that we have. We have LPNs, certified medical assistants, certified nurse assistants, certified pharm techs. We have social workers, and we have chemical dependency specialists. A third of the class has bachelor's degrees, or a third of the patient coordinators have bachelor's degrees, and about 10% have master's degrees. A couple examples: Jethro Francois. He speaks Haitian Creole, speaks French, speaks English, and was a pre-med major. We have Vanessa Payan, who is a certified social worker who spent 6 years in New York with the population there doing social work on a day-to-day basis. And we have Brian Mingle, who's a certified chemical dependency counselor. It's a wide set of skills that we bring because of the various demands of the patients that we serve. The second is their training in management. We spend many weeks teaching them how to use the systems and capabilities available to them to make sure that they really are ready to answer the first call that they will take. And we focus on what we describe as trust, building trust with the patient. And trust we define as a trained patient coordinator who is responsible or responsive to the patient's needs, who gives uniform answers but is always looking out for the safety of the patient and tells the patient the truth. If you have a cold and it's early stage, maybe the best thing for you is to stay home. But if you have chest pain and you're over 65, you've been taking aspirin, the right answer is go straight to the emergency room, and we have to make sure that we give them those answers right. On top of that, it's just a volume issue. We have so many more patient coordinators available to take calls than what we have traditionally had in the BMC call center. And finally, we have a management focus that works on training and quality management programs, and constantly working on how we're working with the team to make the services that they deliver better and more patient-focused.
What does a patient coordinator do?
Well, the best way to answer that is really let them tell you themselves. So we have a couple people who would like to explain what a patient coordinator is and why they chose to be one.
Hi, I'm Ryan Ross. I'm a patient coordinator here at Rise Health. I'm excited to work for Rise because it's an opportunity to usher in the new era of healthcare. As both a patient and a professional working in the industry, I've witnessed firsthand the issues that our healthcare system faces. Rise's new innovative model will be the future of healthcare, to be part of a change that will improve the quality of care for all consumers.
Hi, I'm Lauren Elliott, a patient coordinator here at Rise Health. You know, I wanted to be a patient coordinator because I wanted to be a part of the solution that we have in the delivery of today's healthcare system. You know, the idea of making sure that your patients are completely taken care of prior to them even going in to see their physician, as if they're your family, is truly a rewarding feeling. Everybody has been a victim of horrible service, of feeling like you're not being heard, or even simply wondering if that person even cared. And I am a firm believer in being a part of the change that you want.
My name is Chartrice Dunn. A patient care coordinator is a vital role in the Practice Support Center as an extension of Boston Medical Center's practice. We are very experienced in the healthcare field and have a medical background in specialties ranging from pharmacy, nursing, medical assistance, substance abuse, and billing and coding. We have long history serving and assisting patients in primary care, hospitals, and emergency room settings. We are passionate about Boston Medical Center's patients, and we look forward to partnering with you in serving your patients.
Can you talk about what a practice support center is?
Sure. A practice support center really gets at the heart of the partnership between Boston Medical Center and Rise Health. We talked about the patient coordinators. Patient coordinator is only one part of what we overall think of as a practice support center. There are also legacy BMC team members who are part of our practice support centers. We have RNs who are going to help with care management and complex disease management and triage. There are a new role, or perhaps a redesigned role, of a referral coordinator who will help the patients get to specialist appointments as they need it. One of the struggles we've had is how to coordinate and follow through with the care that patients need from the other specialists that are not primary care at BMC. And of course there's also other patient coordinators that come from legacy or historic BMC staff. Those people all work together in the practice support center, whether they be an RN or a patient coordinator or a referral coordinator. The whole team works together in a seamless way, focusing on the patient from the first time they call through the last visit they make with a specialist.
Okay, are you a patient care?
Why are these people walking around in the practice?
Well, they're what we call practice consultants. Practice consultants are there to help the practice with patient flow, making sure that every member of the care team is working at the top of his or her license. One of our main goals is to make sure that doctors are able to practice at the top of their license, that everything that they do is something that requires their skill. At the same time, we want everybody else on the care team practicing at the top of his or her license. So whether you're a nurse, whether you're a check-in, check-out person, whether you're a physician assistant rooming patients, each one of you bring skills and training and aptitude to the job. And we want to make sure that everybody is contributing in the best way they can. At the same time, just like our patient coordinators, we want to make sure that the team is focused on the patient. Patient flow means how do we make sure that the patient's time in the office is maximized, that they really feel that their visit is focused on them and their time was put to good use. And all of that is what the practice consultant's job is to do, is to look at the way the team works to support the patient and make sure it's optimized.